In regard to community wash, we have two components, the rural water and the sanitation and hygiene promotion. In the rural water component, we are focusing on ensuring functionality of the existing water points. The statistics on functionality show that up to 20% of facilities are non-functional for reasons which are within management. So we have focused on establishing management structures, which we refer to as water user committees, and strengthening them on their roles and responsibilities and equipping them with skills on how they can actually institute collecting operation and maintenance funds from the communities. We have introduced an approach of save and borrow around the water point so that the funds which are collected for operation and maintenance are maintained in a revolving fund that is used within the community to ensure that they are readily available at any one time as and when the water point fails. But also that intervention on rural water functionality has seen communities improve the ownership and the maintenance of these particular water points. They have set up and agreed on rates which they pay on a monthly basis by households to keep their water points functional.
We started pulling in our money, we saved the money, we borrowed the money. Then through that we managed to pay the subscription fee to sustain the functionality of the tap.
This money we are using it on maintenance and operation. The role of the water board to make meetings, to budget for the scheme, to collect the money from the tap user committees, to make reports to our partners.
By the end of last year, we had come to 6.3 million shillings. So as we shared it, we solved our immediate problems like school fees. Some of the members came for loan for agriculture, development loan, and we promoted water and sanitation in our community.
We are teaching the users of the water to clean their jerrycans and to construct latrines at their homes such that whenever they fetch that water shouldn't be contaminated when it reaches at home.
Eliminating open defecation, we have explored the approach of community-led total sanitation, call it CLTS. And in CLTS, communities are triggered into an attitude of desire to eliminate open defecation right from the youngest children in the house to the elders in the community by putting up facilities. And we have seen villages come up to the level of open defecation free status.
There were very few latrines in the beginning. Most of the people were defecating in the open. This open defecation has caused a lot of diseases. The sub-county has, under the health department, instructed the health assistant to go ahead and inspect each household. Each one has now got a pit latrine, and of course other relevant sanitation-related requirements like rubbish pit, like hand washing facilities at the latrines, drying rack.
On the part of hand washing, we have promoted production of local herbal soap locally within the communities, and the introduction of tippy taps, a technology whereby using plastic jerry cans, the communities are able to put up hand wash facilities in close proximity to the latrines, which they have built on their own.
This is a very safe way of washing hands, and it's called a tippy tap. It has a stick that you just step on and you don't touch anything. This is a soap, you just wash your hands, and this is put to prevent animals from eating the soap and also sand from drying the soap. So you wash your hands. It does washing.
The Wash in Schools intervention is effort through the Community Empowerment Program to improve the availability of sanitary facilities in schools, but also the use of sanitary facilities in school. So it focuses on setting up structures that operate and maintain the sanitary facilities using the school structures, establishing school health clubs which are child-led, in a manner by the school to keep the facilities working and in use by the pupils.
I love environment with all facilities for health. A school with good latrines, tip-it-up, water sources, teachers' houses are signs of colorful sanitation.
Amate fi soroni amate poba. Alo salo mi fi soroni alata mi so zirwe la kote. Soroni azanga. Ate twa mi ata nos kumi to nga ja mi to nga fale nu rundia mi fi soroni. Butia mata kwala ma fe me do afene ni de. Makine onan no ne batenga soroni ama ditipta ma badutilia soroni tilogogo.
Specifically talking about menstrual hygiene component under the washing schools, it focuses on preparing the girls to experience their first periods. It equips the senior woman teacher with capacity to counsel. A special package in this community empowerment program was the introduction of the reusable menstrual pads, which we call the ramps, which are locally made by the communities using local materials. It's life skills that is given to the girls so that they're able to experience their first period with dignity. But it also does not end there. The boys are also trained on how to support the girls as they go through the periods.
My sisters, that they don't afford to buy the classic ones. So I would like to learn and I teach them how to make the local ones.
And then the fact that these are children who have grown or who have lived in a society where discussing or sharing issues of sexuality is perceived as something very wrong. You see, you find the girls themselves don't know how menstruation comes about. For them, that's when the girls look at it as a disease. The boys look at it as something very different, that maybe the girls have aborted. When they say girl has stained her uniform, she has aborted. You see that? But now, after them really getting to know, there's a which has so much changed their attitude, and they've learned really to appreciate the girl child and somehow support them. At least after us training, this should be in position to go back home and maybe really push for materials from their parents.